The question for Ask Dr. Durie this week is actually quite a common question. The patient goes in to see the doctor and the doctor says, "Oh gosh, I think your myeloma treatment is damaging your liver." Is this likely to be correct? Well, myeloma therapies can sometimes damage the liver, but this is rather uncommon. It really is very rare that you would be taking a myeloma treatment, one of our novel agents, thalidomide, Revlimid, Velcade, carfilzomib, pomalidomide, these new agents, and then suddenly they would start to damage the liver. There are definitely a very, very small number of patients where this can happen, and it's important to keep it in mind, but it's much, much more likely that the abnormal liver function tests that the doctor is seeing in the test results are being caused by something else. And that commonest something else is some other kind of medication or a herbal or a dietary supplement that you're taking, or maybe to something incidental and different like some type of hepatitis. There have been some new types of hepatitis discovered, and there's one type called hepatitis E, as opposed to the more common C type, which can kick in and cause some abnormal liver test results in myeloma patients. So you need to think about, what else am I taking? Am I taking any other medicines that could perhaps be causing abnormal liver function tests? The commonest drugs are actually antibiotics. Simple ones like Amoxicillin, other drugs, non-steroidal anti-inflammatory drugs. These are things like Advil, for example. Also, very common drugs that are used to lower the cholesterol, like statins, the commonest one being Lipitor, for example. So some of these different kinds of drugs are much more likely to be what are causing abnormal liver function tests. So, look for other causes. The simple thing to do is to bring this up to your doctor and say, well, how about doing a search on PubMed, which is the computer system where these kinds of cross-reactions and toxicities would be listed, and see if any of the medicines that I'm taking are causing or capable of causing liver test problems. And it's highly likely that that will turn up the answer, and stopping the medication will almost always reverse the problems and solve the problem, actually. So this is an area to be very much aware of, and hopefully the identification of the drug and the stopping of the drug will solve the problem for you.